Hey guys, skeleton. Uh, First chapter, which is chapter 7, goes into the axial skeleton. And the axial skeleton is going to be the bones of the head and the trunk, so essentially your cranium, your skull, the vertebral column, which is your spine, and the thoracic cage, okay, which would include your breastbone, the thoracic vertebrae, and your ribs. Chapter 8 we'll get into tomorrow. This will include the bones of the limbs. Okay. So looking here, looking at this image right here, we can see the bones that are highlighted in yellow here. These are going to be the bones or the structures that are part of the axial skeleton. Okay. If we look at the skull, there are 29 bones that are part of the skull. This includes the main bones, but also accessory structures or associated bones, which would be your auditory ossicles, 3 in each ear, as well as the hyoid bone. Looking at the skull itself, we're going to have 8 cranial bones, 14 facial bones. The thoracic cage, you will have 12 pairs of ribs for a total of 24 ribs, and a sternum, which is more commonly referred to as the breastbone. Now, what you are seeing here in blue, this is actually indicating cartilage, and this is actually going to be hyaline cartilage, okay? And you can actually see some blue between the vertebrae. That's actually a different type of cartilage. That's fibrocartilage. But in the blue, that's indicative of cartilage. The vertebral column will consist of 26 vertebrae. You have 24 vertebrae proper, per se, which would include cervical, thoracic, and lumbar. And then you have a sacrum, which is actually formed from 4 to 6 fused vertebrae, but it is considered a single structure, the sacrum, and then the coccyx, which is more commonly referred to as your tailbone. So here is another image looking at, the axial skeleton here, okay? And as I mentioned, we're going to go through each of these. In total, the axial skeleton will have 80 bones, and I just broke down the breakdown there, okay? So what are the functions of the axial skeleton? The functions are to support and protect organs within its body cavities. So you have some very vital organs which are protected by the structures of the axial skeleton: the brain, the spinal cord, heart, and lungs. It also provides points of attachment for muscles that are going to allow you to adjust positions of the head, neck, and trunk. Muscles that will allow you to breathe by actually changing the pressure within the thoracic cavity by changing the volume, and also help to stabilize the attachment points for the appendicular skeleton. So let's look at the skull. The skull will contain 22 bones, 8 cranial bones, and 14 facial bones. The 8 cranial bones will actually form the cranium, which is going to include the calvaria or skull cap. And the purpose of the cranium is to enclose the cranial cavity where the brain will actually sit. Now, when we get to the nervous system, I'll bring this up again, but your brain actually doesn't sit in the cranial cavity. It actually is suspended. And the reason is that you actually will have cerebral spinal fluid surrounding the brain itself, and you will actually have ventricles within the brain that have CSF. This creates buoyancy, so your brain is actually floating within the cranium. You also have 14 facial bones. The purpose of these facial bones is to protect and support the entrances to the digestive and respiratory tracts. the breakdown of the cranial bones, we have a single occipital bone, which is located at the base, two parietal bones on either side, a single frontal bone, two temporal bones, and a single ethmoid and sphenoid bone. Looking at the facial bones, you're going to have two maxilla, and it appears as one structure, but it's actually fused together, two bones fused together. Two palatine bones, again fused together, two nasal bones, two inferior nasal concha, two zygomatic bones, a single vomer, and a single mandible. Out of the 22 bones that actually make up the skull, the mandible is the only movable bone out of all 22. Associated bones, these would include the hyoid. An interesting fact about the hyoid bone is that it is not directly attached or articulate with any other bone in the body. And then we have our auditory ossicles. The auditory ossicles will be detailed a little bit later when we get to hearing, but these are three tiny bones that are actually quite small, but they're found within the ear canal of either ear. And if you've ever been to the Mutter Museum, they actually have the ossicles, on display, so you can actually see them. Okay, so let's look at the facial bones. There are 9 superficial facial bones. These are for muscle attachment, and then we have 5 deeper facial bones. The 5 deeper facial bones will actually help to separate the oral and nasal cavities, and it will also increase the surface area of the nasal cavities. This will become very important when we talk about the respiratory system, because by increasing that surface area, we're allowing for more space for air to be warmed and humidified. The 5 deeper facial bones will also help to form the nasal septum. Within the skull, we do have what are referred to as immovable joints. These are going to be connection points between 2 bones. And there are 4 major sutures. The sutures are the immovable joints: lambdoid, coronal, sagittal, and squamous sutures. The lambdoid suture is actually going to separate the occipital bone from the 2 parietal bones. The coronal suture will attach to the frontal bone to the 2 parietal bones. The sagittal suture will be between the 2 parietal bones themselves. And it will go from the lambdoid suture in the back to the coronal suture in the front. And the squamous suture is going to join the temporal bones with the parietal bones on either side. The common bone here that is actually articulating with all of the other cranial bones is the parietal bones. So looking at the skull here, you can see your 2 parietal bones. This is a sagittal suture separating those 2. Here's our occipital bone. We can see the lambdoid suture separating the occipital from the parietal. And then the squamous suture is going to separate the temporal from the parietal bone on either side. Okay. One way to remember this is actually a flattened region. Okay, and if you remember from our tissues, squamous actually refers to flattened surface. Okay, so that's one way I always remember this is where the squamous suture is. Looking at the front, here's our frontal bone. So your nasal passageways is here, your eyes are right here. So this is your frontal bone. We have the coronal suture going from one end to the next, right here. Okay. And again, there's that sagittal suture separating the 2 parietals, lambdoid separating the occipital from the 2 parietals. Okay. So looking at our cranial bones, looking at a lateral view here, we can see our frontal, parietal, temporal, occipital, okay? And then we have our facial bones all located here. Some important structures, and this is very important because you'll notice some of these structures are actually found on your list that you have to study. So this is, I love these figures that your textbook actually has here. The frontal bone, we have the supraorbital foramen. This is this tiny little right here. This is where cranial nerve 5 will actually pass through, as well as supraorbital artery. The sphenoid bone, this is this purple bone right back in here, back here, all the way through here. When we actually look at this bone in a few minutes, this is actually a big bat-shaped bone. You're actually going to have the optic canal on either side. That's this hole right here. This will allow the optic cranial nerve to pass through, which is cranial nerve number 2. You have the superior orbital fissure. This is actually going to allow the passage of 4 nerves, 3, 4, 5, 2 branches of 5. And then the inferior orbital fissure, which is down here, will allow for the a branch of the cranial nerve 5 and an artery to pass through as well. In the mandible, we have the mental foramen. This is actually going to allow the mandibular nerve, which is the 3rd branch of cranial nerve 5, to pass through here. Okay. Looking at some of our facial bones, we have the zygomatic bone here in blue. Your maxilla is here in orange. The vomer is this guy right here. And coming down and meeting the vomer right at the midline here in green, this is the ethmoid bone, okay? In purple right here, this is our nasal bone. You can see the maxilla sort of come up next to the nasal bone. Then we have our lacrimal bone right here, okay? And then we can see the ethmoid and then part of the palatine back here. If we take our skull and flip it upside down, so we're looking at an inferior view, here you can see the base of the skull. This is the occipital bone right here, okay? But the other thing I want to point out here, here's your maxilla. So this is your upper jaw. The lower jaw has been removed. But looking at the maxilla right here, okay, you can see that it is 2 bones that are fused together. Same thing with the palatine bone. Okay, you can see 2 bones fused together right here. This big guy in purple right here, this is the sphenoid bone, okay? And then we have in red or pinkish color here our temporal bone and then the occipital bone. Very important structure with the occipital bone is the foramen magnum. The foramen magnum is actually going to be a very large hole that allows the vertebral column to pass through, or the spinal cord, not vertebral column, sorry, the spinal cord to pass through. Another very important structure right next to the foramen magnum and the occipital condyle, where the base of the skull will sit onto the vertebral column, is the jugular foramen. This is where the internal jugular vein will essentially leave the brain and head back down to the heart. Here's just looking at a sagittal cut where you can see these bones. And actually what I'll do is I will post, we have an image of a hemisected head that I will also add to the this part, the chapter. It'll be a separate PowerPoint. It's only 2 images in that PowerPoint. If we were able to go into the cadaver lab, we would actually pull this head out and you guys would be able to see it, but I actually have a picture that I'll end up posting. Just look for the PowerPoint. That's this hemisected head. Now, this is actually looking at the floor of the cranium. So what we did was we cut off the top half here, okay? And now you're looking down at the base. And what you see is the frontal bone right here. In green is the in green is the ethmoid right here. In purple is our sphenoid. So these colors are staying consistent throughout the figures here. An important structure is the sella turcica right here. The sella turcica is going to essentially be a structure that will house the pituitary gland. And that's found within the sphenoid here. I'm sorry, yeah, the sphenoid here. We can see our two temporals and then our occipital bone at the base here. Within the cranium, we will have sinuses. These are air-filled chambers in the skull. And the function of sinuses is to decrease the weight of the skull. They are lined with mucous membranes, which will produce mucus to moisten and to help clean the air. The sinuses also play a very important role in resonating chambers in speech production. Okay, so let's look at our cranial bones in a little more detail. The first is the occipital bone. General functions is that it forms much of the posterior and inferior surface of the cranium. The joints are going to be with the parietal, temporal, sphenoid, and first cervical vertebrae. Now, most of the vertebrae are just going to be listed as either C1, C2, C3, C4, so on and so forth, or T1, T2, so on and so forth. But C1 and C2 actually have special names. So C1 is also referred to as the atlas. C2 will also be referred to as the axis. Some regional markings to the occipital bone. We have the external occipital protuberance. This is a small bump at the midline on the inferior surface, and this is mainly from muscle attachments. The occipital condyles, these will articulate with the first vertebrae. The foramen magnum, I mentioned and I pointed this out in the image. This is essentially the big hole at the base of the occipital bone, and this will allow for the spinal cord to pass through from the medulla. So looking here, we can see this is our occipital bone. You can see the foramen magnum right here, and here's that external occipital protuberance. Again, whenever you see a bump like that, that's mainly for muscle attachment. Okay. The parietal bones, these are going to form part of the superior and lateral surfaces of the cranium. And the parietal bones are going to, with each other, are going to form joints with the occipital bone. So that the parietal bones will form joints with the occipital bones, with each other, with the occipital bones, the temporal, frontal, and sphenoid bones. Regional markings, you'll see the superior and inferior temporal lines, which will attach to the temporalis muscle, as well as grooves for the cranial blood vessels. Okay, and again, I know it's very difficult to see on this image here, but there are actually little protuberances or lines that are sort of sticking up here that would be for muscle attachments. The frontal bone, this forms the anterior part of the cranium and the roof of the eye socket. It contains the frontal sinuses. The joints that the frontal bone can form are the parietal, sphenoid, ethmoid, nasal, lacrimal, maxillary, and zygomatic bones. And what you're going to see is a lot of these bones actually also contribute to the overall orbit of the eye. Regional markings, we have the forehead, the supraorbital margin. This is actually the region just above the eye. The glabella, this is between the supraorbital margins. The lacrimal fossa, this is actually a little indentation for the lacrimal glands. And then you also do have your frontal sinuses located in the frontal bone. The supraorbital foramen, this is for blood vessels of the eyebrows, eyelids, and frontal sinuses. And then we have a supraorbital notch, which is an incomplete supraorbital foramen. So looking here, we can see some regions of the frontal bone. Again, here's your forehead right here. I'm sure you guys are pretty aware of that. Glabella is the region between the two supraorbital margins. Okay. All right, temporal bones. This is going to form parts of the lateral walls of the cranium and zygomatic arches. The temporal bones will articulate with the mandible. They will surround and protect the inner ear, internal ear. and they will attach muscles of the jaws and the head. The temporal bones will form joints with the zygomatic, sphenoid, parietal, and occipital bones, as well as the mandible, which is a movable bone. Some markings of the temporal bones: you have the squamous region, the zygomatic process, the mandibular fossa, the mastoid and styloid processes, which are important for muscle attachment, and then the auditory ossicles, which are those tiny little bones. So looking at the, I'm going to go to a little picture here of the, for the temporal bone, for the temporal bone, know the squamous part, know the zygomatic process, and the auditory ossicles. Those are the three tiny little bones. As far as some openings within the temporal bone, the carotid canal, this is going to be important for the internal carotid artery. This is very important because this is one of the major arteries supplying the brain its blood. The external acoustic meatus, this is where you're going to find your eardrum, which is also referred to as the tympanic membrane. Okay. And then you'll have some other foramen, the stylomastoid foramen and internal acoustic meatus, which are for nerves and blood vessels to pass through. So looking at the temporal bone right here, you can see the squamous part. Okay. This is the internal acoustic meatus. This is essentially your ear canal. Okay. Here's the zygomatic process sticking out. Here's the styloid and mastoid processes. Again, these processes, you'll see these names again when we get to the muscles. Skeletal muscles will attach to these. Sphenoid bone. This forms part of the floor of the cranium. It unites the cranial and facial bones, and it strengthens the sides of the skull. This will form a joint with the ethmoid and frontal bones, the occipital, parietal, temporal, palatine, zygomatic, maxilla, and vomer. It's called one of the keystone bones because it actually does articulate with most bones in the skull. Some important regions that I want to point out here is the sella turcica, the greater and lesser wings, and the pterygoid processes. The sella turcica, this is a saddle-shaped enclosure. It's located on the superior surface of the body of the sphenoid. And again, as I mentioned a little bit earlier, this is where we're going to house the pituitary gland, along with the hypophyseal fossa. The greater and lesser wings, these are going to be the projections coming out from the sphenoid. They look like wings of a bat. Okay, so you'll see those in a second. The pterygoid processes, these are going to allow for muscle attachment, specifically a group of muscles called the pterygoids. Some important forama of the sphenoid, the optic canals will allow for the passage of the optic nerves. The superior orbital fissure will allow blood vessels and nerves of the orbit to pass through. And the foramen rotundum and ovale, this is again more blood vessels to pass through. So this is your sphenoid bone. This is looking at a superior surface. Here, if you were to see this, this would be a nice little cradle region right here, the sella turcica. Again, this, if you look at the image of this, it kind of looks like a bit of a bat. This is looking down into the skull, so you can see the position of this. Again, one of the two main structures that I want to point out from here, the sella turcica, okay, and the optic canal. The optic canal is where the optic nerve will pass through. This is looking at the anterior surface, so this is looking actually straight on. So, you know, you're looking into the skull. You know, this is what you would sort of see staring it straight on. Here you can see these pterygoid processes sort of sticking down. And again, these are going to be very important for muscle attachment to those pterygoid muscles. Okay, ethmoid bone. The ethmoid bone is going to form the anterior medial floor of the cranium. It will also form the roof of the nasal cavity and part of the nasal septum, as well as medial orbital wall. It does contain a network of sinuses within the ethmoid. The ethmoid bone will form joints with the frontal, sphenoid, maxilla, nasal, lacrimal, palatine, inferior nasal concha, and the vomer. Some important structures of the ethmoid bone would be the cribriform plate. The cribriform plate is going to form the roof of the nasal cavity and the floor of the cranium. It's also going to contain the crista galli, which will attach to the falx cerebrae. The falx cerebrae is going to be a tough connective tissue that helps to anchor the brain in place. The perpendicular plate of the ethmoid bone, this will actually form part of the nasal septum. You have the olfactory foramen, which is located within the ethmoid, and this will allow your olfactory nerve to pass through, a very important nerve that allows for the sense of smell. And this is looking at the ethmoid from the superior surface, so looking straight down on it, okay? Looking at it from the posterior surface, you can see the ethmoid here, okay? Okay, and that is our cranial bones. Okay, so for the facial bones, here's our list of facial bones, and let's look at each of these individually. The first is the maxilla. The maxilla is actually going to form your upper jaw, part of the upper jaw. And the functions of the maxilla is that it will support the upper teeth, will form the inferior orbital rim, so it forms the base of the orbit of the eye. Will also form the lateral margins of the external nares. The external nares are the opening of your nose. Form the upper jaw, most of what we call the hard palate. And it will also contain the maxillary sinuses, which is the largest of the sinuses that we have. The maxilla bone will form joints with the frontal ethmoid and with each other. All other facial bones, as well as all other facial bones except the mandible. So here are some markings that we find on the maxilla. The orbital rim will help to protect the eye and other structures. You have what's referred to as the alveolar process. This will support the upper teeth. The palatine processes, which will form most of the hard palate. Maxillary sinuses, again, this is the largest of the sinuses that we have. Again, functions lightening up the bone. Looking at the foramen, the infraorbital foramen, this is actually going to allow for sensory nerves to the brain. And the inferior orbital fissure will allow for cranial nerves and blood vessels to pass through. So this is one half of your maxilla, okay? Here's that infraorbital foramen right there, all right? And you can see how this is actually forming part of the inferior orbital rim. So if you position this in here, you can see how it forms part of the orbit of the eye. Palatine bones, they're also going to form the posterior part of the hard palate, and they will also contribute to the floor of the orbit. The palatine bones will form joints with each other. They are fused like the maxilla. They'll form joints with the maxilla, sphenoid, ethmoid, inferior nasal concha, and the vomer. Looking at the palatine bones, some regional markings here. The horizontal plate will form posterior part of the hard palate, and the perpendicular plate will extend from the horizontal plate to the orbital process of the orbit floor. There are many foramina located, which will allow various nerves and blood vessels to pass through. Your nasal bones, they support the bridge of the nose. They connect to cartilage of the distal parts of the nose that extend to the external nares. The nasal bones will form joints with each other, the ethmoid, frontal, and maxilla bones. Your vomer, this forms the inferior portion of the bony nasal septum, and this will form joints with the maxilla, sphenoid, ethmoid, palatine bones. This will also allow for attachment of the cartilage part of the nasal septum. Your inferior nasal concha. The inferior nasal concha functions in slowing inhaled air. It creates air turbulence within the nasal cavity. It also will increase the epithelial surface area to warm and humidify the inhaled air. The joints that the inferior nasal concha form is the maxilla, ethmoid, palatine, and lacrimal bones. Your zygomatic bone, more commonly referred to as your cheekbones. This is actually going to also contribute to the lateral walls of the orbit, so the sides of the orbit of the eye, the lateral sides. It will also form parts of the zygomatic arches. The zygomatic bones will form joints with the maxilla, sphenoid, frontal, and temporal bones. Your lacrimal bones, these are the smallest of the facial bones. They contribute to the medial walls of the orbit of the eye. The joints of the lacrimal bones are going to be with the frontal, maxilla, and ethmoid. And you have the lacrimal sulcus, which is the location of the lacrimal sac, more commonly referred to as your tear sac, or which is where tears are produced. Okay, so looking at all of these cranial bones, facial bones here, sorry. Here's our nasal bone right here, okay? And then right around this region here, we start to see maxilla. Our sphenoid is deep in the eye socket here. Here's our temporal. Zygomatic coming around here. You can see the little articulation right here with the maxilla. So this border line right here, this is our zygomatic with the maxilla, okay? Your vomer is this guy on the lower half. The ethmoid is going to be on the upper half here, specifically the perpendicular plate. Next to the nasal bone, which is right here, we'll have the lacrimal bone, okay, located right here. Your inferior nasal concha is located right here. And I'm trying to think if there's anything else. We have our little lacrimal sulcus. This is a little indentation within the lacrimal bone where the tear sac will sit. Your mandible, this is your lower jaw. It is the only movable bone, and it will form a joint with the temporal bone. The mandible will have a body, which is the horizontal portion, an alveolar part, which is going to be the sockets for the teeth, a mental protuberance, which attaches to facial muscles, and then the ramus, this is the ascending angle of the mandible on either side, which will articulate with the temporal bone. And what's going to happen with the, you can see here, this is the body. The alveolar part is where you're going to have the sockets into the teeth. Here's the angle, and then the ramus. And then this is actually going to anchor in right here into the temporal bone and form that temporal mandibular joint. The way that this sits in is this actually allows for a nice rocking motion back and forth for the lower jaw to move. Okay, the hyoid bone, this is actually a bone unto itself. It supports the larynx, and it will attach to the muscles of the larynx, pharynx, and tongue. It actually does not directly attach to any other bone or articulate with any other bone, but what you will have is the attachment points of many ligaments, which will help to sort of support that whole area. And here is your hyoid bone right here. And it's typically located right here. This is your larynx right here, your trachea here. So it's just above the larynx there. Okay, so the orbits of the eye, or your eye sockets, these are 7 bones, will form the orbital complex to form each orbit of the eye. And the 7 bones are the frontal bone, your 2 maxilla, the lacrimal bones, ethmoid bones, sphenoid, and palatine and zygomatic bones. And it sort of gives you the boundaries of each of these bones. And, you know, looking at this image here, I believe you have this image also in your atlas. Here's our maxilla bone, zygomatic, frontal here, our lacrimal in red, okay, the ethmoid in green, sphenoid back here. Okay. Unfortunately, you're not going to get a nice color-coded image on the exam for identification purposes. You'll see more of something like this. So this is definitely a good figure to come back and study with. The nasal complex, this is made up of bones enclosing the nasal cavities and paranasal sinuses. This will include the frontal bone, sphenoid, and ethmoid. This is all going to form the superior wall of the nasal cavities. The maxilla, lacrimal, ethmoid, and inferior nasal concha, which will form the lateral walls. The maxilla and nasal bones, which will form the bridge of the nose. I mentioned these sinuses that we have. The function of these sinuses is to help to lighten the skull bones. They will contain mucus epithelium, which will release mucus into the nasal cavities. Very, very important function of the the paranasal sinuses is to warm and humidify that air as you are breathing in. As far as your nasal sinuses are concerned, or your paranasal sinuses, you have 2 frontal sinuses, you have several ethmoid sinuses, pockets here, our sphenoid sinuses right here, and the maxillary sinuses. And if you go to a doctor and they suspect you have a sinus infection, you'll feel they'll put their fingers within these areas and they'll push. If there's an infection, you're going to have buildup of fluid in there, and the counter pressure of them pushing will actually create a little pain. And they'll, you know, when they apply that pressure, you'll be like, ouch, and they can see exactly where the infection is. Also, that's why, you know, when you start to build up the pressure within these sinuses, it really hurts. And if you've ever had a sinus infection, you are very well aware of that. Okay, and that's going to be it for the skull for part 1. Okay. Part 2 will include the vertebral column and the thoracic cage.